Hey everybody, and welcome to Nursing U. I'm Professor Belfon, a board-certified family nurse practitioner for over 12 years and a nursing professor for over 3 years. As a nursing professor, I've encountered countless amounts of students just like you who find nursing at this stage to be a little bit difficult. And like I tell my students who are wondering how come nursing and med-surg is so different from classes that they've taken before or even their prerequisites. And I'm here to tell you the main reason that you're struggling with nursing school is because you haven't mastered the concept of how to think like a nurse. Nursing is unlike any other profession where it takes a certain amount of skill as well as art in order to be successful. I want to share with you my tips on mastering nursing school, simplifying disease processes, and most of all, how to think like a nurse. Okay, before we jump right into it, there are certain things that can be taught, and then there are certain things that can't be taught. If you are going into nursing for the wrong reasons, I want you to just take a moment to really reflect on your why. Why are you here? What is motivating you and driving you to continue to go on into the nursing program? And if it is for money or esteem or accolades, I really want you to reflect if this is truly the profession for you. So a couple of those things that cannot be taught is, number one, empathy. Number two, respect for yourself, respect for your patients, and respect for the profession. Number three, patience. Patience goes a long way, especially as you're learning and you're growing in this field. Nursing can be a very thankless job, but it is, at the end of the day, very rewarding. So here are my top concepts for success in nursing school. So the first concept is going to be learning how to prioritize. You must prioritize and recognize what's important. And when in nursing school, that translates to recognizing and prioritizing which patient on an exam or which patient in a clinical setting needs to be assessed first. A good rule of thumb is always airway, breathing, circulation, and don't forget safety. Safety is also very important to prioritize, not only for your patient, but also for yourself. The second concept is knowing your scope of practice and practicing within it. As registered nurses, and especially in nursing school, we can be bombarded with a lot of information. Some of that information is not even applicable to your scope of practice. Although we want you to be familiar with what happens with other disciplines, really zone in and focus on what's important for you as a registered nurse and what can you actually do within your scope of practice. My next concept is don't overthink it. Only answer what's asked of you. Read the questions thoroughly and really think to yourself, what are they asking me? The next one is balance. Study smart and not hard. Take breaks in between studying and really study with intention. Reading as much as you can read when you're tired, when you're hungry, or when you're going through ups and downs in your life does not mean you're going to retain the information. If anything, because of what's happening around you or other circumstances, you may actually block out very important concepts that you read. So make sure you're balancing studying along with things that make you happy. My next concept, know your rationale. If you don't know why you're doing something, you have two options. Either look it up and figure out why you're doing it, or two, you probably shouldn't be doing it. So then don't do it. Last but not least, breathe. It'll all be over soon. Nobody knows everything. In the nursing program, the NCLEX really wants to make sure that you have at minimum the same level of education to make informed and safe decisions for patients at the basic level. Once you get your first job and even your second and your third, you will continue to add on to your education and your expertise and your knowledge. So let's move on to what I find to be my top 3 study tips, okay? So the first one is be selective. Focus on key information, ignore unnecessary details. I'm not telling you to ignore everything that you don't think is important, but really take the time out and really sift through this information and really focus on key details and things that are important. Eat the fish and spit out the bones, all right? Study tip number 2 is use a system for consistently organizing notes and that you will actually use and review. We've all been there where we've written down probably half the book. I've done it many times over. And it's not an effective way to actually study because you're never going to go back in and you're never going to review that material. And even if you try, it's way too much material to review, to cram, or even to test yourself on. Listed in the bio, I've included my free template that I've personally created for my students to sift through information that is important and that will be important to you as a nurse. You can formulate whatever works best for you, but I find this to be one of the most organized ways of sifting through disease processes and making it super easy to go back in and review that material later on for exams or just for your own personal knowledge. Now, this is still a part of study tip number 2, and this is how I recommend, this is just my advice, how I recommend my students to approach studying. So the first thing that I encourage them to do is read the chapter before class. If I didn't mention it earlier, nursing is unlike any other profession. So if you're used to just being naturally smart, you're going to still struggle. You must learn how to study. And yes, you have to read the book. Use those PowerPoints or homework in order to focus on the topics that's going to actually be covered. I myself teach basic med surg, and we share the same textbook that advanced med surg actually shares. And in some of those chapters, my students are not responsible for those disease processes at this stage. Some of those disease processes will be covered in advanced med surg. So therefore, I encourage them to really go into the PowerPoints and really see what topics or what diseases that I'm going to focus on in each individual chapter. Class should be a very interactive environment. So class should be for reinforcing the information that you've already exposed yourself to, or even building on your current knowledge base. Class is not the first time that you should be hearing this information, because you lose the opportunity to really pick your professor's brain and to really get everything out of lecture. So make sure you read before coming to class. After writing these notes, gather up all that material that you've done prior to class, your reading, test your knowledge. When learning has occurred, you will be able to regurgitate 5 important key details about either the concept or the disease processes that are pertinent to your role as a registered nursing student. If you cannot recite things such as pathophysiology, signs and symptoms, medical treatment, or nursing interventions, then you probably have not mastered that concept. And I would personally encourage you to star that in your notes and go back in and review that material. Lastly, my favorite, this is a bonus, teach somebody. Your family is dying to know all of the things that you're learning about, and they're so proud of you. So take that opportunity to teach a family member about a disease that they may be struggling with, or just to share your knowledge about the concepts or the diseases that you're learning about. When you teach someone else, you absorb about 90% of that information. So make sure you're able to teach a family member, so when you're out in the field and practicing, you're able to simplify and teach your patients. Remember, as a nurse, part of our role is advocating and educating our patients. Nursing school is one of the most exciting and memorable times of your life. Your first nursing degree is unlike any other degree that you're going to attain as you progress along the nursing successful ladder. This is your true base and your concept of your knowledge. So whether you aspire to be a nurse practitioner, a nurse anesthetist, a nurse administrator, or even a nurse educator like myself, you need to make sure you have a great, solid knowledge base. And this is it right here. You're not alone. We've all been through the same step as you, and we've made it out on the other side. So if you like this video and you are interested in getting more information from a professor like myself,